If you're new to claims pricing, health insurance, or programs like Medicare and Medicaid, the terminology can be overwhelming. This short glossary will help you understand the most important billing and insurance terms. Advance Beneficiary Notice, or ABN, is a statement from a healthcare provider informing patients when Medicare may not cover a service. Assignment of Benefits, or AOB, is an agreement allowing insurance companies to pay healthcare providers directly instead of the patient. Adjudication is the process where an insurance carrier evaluates a claim to decide how much will be reimbursed. So, an adjustment or write-off is, basically, a change to the billed amount to account for negotiated discounts or corrections. Accounts receivable, or AR, refers to payments still owed to a provider for services rendered. The allowed amount is the maximum amount an insurance company agrees to reimburse for covered services. Ancillary services are, well, additional healthcare services like lab tests or surgeries, and they're separate from room and board. The annual election period is, basically, the time from October 15th to November 7th when Medicare patients can join or change their insurance plans. Ambulatory surgical care, or ASC, refers to facilities that offer same-day surgical procedures, without any overnight stays. So, charge capture is all about recording medical services, making sure providers can, receive payment accurately. The Charge Description Master, or CDM, is basically a complete list of healthcare services, each with their corresponding prices and codes. A clean claim is, well, a complete and error-free claim that can be processed without any delay. So, claim denial happens when a health insurance plan refuses to pay part or all of a claim. It can be frustrating, but it's basically the insurer saying, hey, we're not covering this expense. Claims pricing is all about determining the allowed amount for a claim, based on established rules. It's how the insurance company decides what they'll actually pay out. The Centers for Medicare and Medicaid Services, or CMS, is the federal agency that manages Medicare and Medicaid programs. They're the folks who set the standards and keep everything running smoothly. Alright, let's talk about certification numbers. These are essentially authorization numbers that prove treatment has been approved by your insurance. It's, a crucial step in ensuring that your healthcare services are covered. Next up, we have coinsurance. This is the percentage of costs that patients pay after the deductible is met. It's how basically you share the costs with your insurance company once you've hit that deductible threshold. Now, let's dive into commercial health insurance. This type of insurance is provided by private or non-governmental entities. It's, in essence, a way for individuals to get coverage outside of government programs. Coordination of benefits determines how multiple insurance policies work together for one patient. Deductible is the amount a patient pays before insurance begins to cover costs. Diagnosis-related groups, or DRGs, are a system grouping hospital cases with similar diagnoses to determine reimbursement rates. An explanation of benefits, or EOB, is basically a statement showing how a claim was processed and paid. Electronic Remittance Advice, or ERA, is just an electronic version of the EOB. A fee schedule is a list detailing the maximum payments for each service or procedure. It's how the prices are set, really. Fee-for-service is a reimbursement model where each service is billed separately. HCPCS and CPT codes are, standard codes used for reporting medical procedures and services. A health savings account, or HSA, is basically a pre-tax savings account for medical expenses. IPPS stands for Inpatient Prospective Payment System. It's a Medicare system that basically sets fixed rates per hospital discharge depending on the resources used. Medicare is federal health insurance designed for individuals who are over 65, or for those living with disabilities. Medicaid is a joint federal and state program that provides healthcare to low-income individuals and families. So, MSDRGs are basically categories in the Medicare payment systems, and they're determined by things like diagnosis, procedures, and, patient conditions. New technology add-on payments are, well, additional payments that help Medicare adapt to new medical technologies as they come along. The Outpatient Prospective Payment System, or OPPS, is a system that pays fixed amounts for outpatient care, instead of, paying for each individual service. Pre-authorization means getting approval from the insurance company before treatment. Basically, it's like making sure you have the green light before moving forward with your care. So, your primary care provider, or PCP, is basically your main doctor who manages your overall health and, coordinates your care. Upcoding is actually a fraudulent practice where billing is done for more expensive services than what was really provided. A superbill is, well, a detailed receipt that lists all the healthcare services you received. Health insurance programs can be confusing, right? Micro-Dyn Medical makes the payment process a whole lot simpler with accurate claims pricing software for OPPS, IPPS, and ASC systems. With Micro-Dyn, healthcare billing becomes efficient, transparent, and compliant. Simplify healthcare billing with Micro-Dyn Medical. Learn more at microdynmedical.com.